Hello, Dr. Hill here. Again, another video for you guys. Obviously, you know we like doing these. They're good, they're fun. Let's just keep them going, all right? So we've done a lot of the memes. You've seen some fun ones. You've seen all that. We're actually going to do a real dentist one with real questions from Reddit, which probably almost all of you have heard of. And it's actually from a stream. It's the Ask a Dentist stream and thread. So that way, these are questions that are literally asked on this for hopefully dentists to answer. We're going to kind of go through a couple of them, kind of give you some answers and go from there. All right, let's get to it. All right, is tongue tie surgery necessary for managing TMD? I, 26-year-old female, have been told I have a tongue tie before, but has never interfered with my eating or speech, so my dentists haven't done anything about it. I also have issues with TMD that are worsening, and my new dentist seems to think laser removal of my tongue tie will help. I looked up how much this costs and am super hesitant. Any insight? Okay. Couple things. Usually, the majority of dentists nowadays are not going to do much for a tongue tie as we age. So, what I mean by that is when we are younger, tongue tie usually is an issue that gets brought up, and it's something that dentists usually handle. The reason why, as we're aging, when we're younger, we're starting to really learn our speech. It's easier to grasp, things of that nature. As we age, getting rid of your tongue tie, I was going to say untongue tied, but that's not really a word. Getting rid of your tongue tie and loosening it, allowing your tongue more freedom, things like that. It has been thought, and the processes are, that it could potentially be more harmful. It doesn't cause as much positive issues as it does potential bigger issues, right? Now, correlation to TMD. I have not heard many exact ties as a source of being a issue of your joint. That's what the TMD is talking about, the temporomandibular disorder, disease, whatever you want to call it. And it's all about the joint, right? So what she seems to be asking is she getting worse joint pain because of a tongue tie? I have never seen a direct correlation to that or any studies that are directly correlated to that. What I will tell you that I do know from personal experience of patients of mine is that they feel that they are trying to overcompensate things where they're potentially having to move their jaw more, clinch, grind, chew, things like that because they can't use their tongue as much. That could be correlated to getting more joint issues. I have seen that. I have heard of that. I have read a couple things about that. But to say a tongue tie is directly related to a worsening joint, I think that's kind of patient-based. That's a tough one to answer. Could it benefit you? Absolutely. Could it potentially help your TMD? Maybe. I think there's some other better ways to kind of help with that than focusing on the tongue tie. But that's a great question. I officially can say I've never been asked that question before. So that is actually a damn good question. Cosmetic dental implants. Would most dentists who do dental implants be able to replace 4 of my teeth with vampire teeth? Or am I just going to get the usual weird looks and rude responses? Well, damn. I don't know what dentist you go to that wouldn't answer that, but I don't know. So, first of all, dental implants, fantastic. Love them. They're great. They last forever as long as they're properly done. They will be around a lot longer than you, me, everything in our bodies. They are going to be a part of you for a long time when done right and healthy. Now, the vampire teeth, I don't know if they're talking about the pointy vampire teeth. I don't know if they're just talking about calling the implants vampire teeth since they're fake. I'm not really sure. But yeah, dental implants can literally replace a single tooth, 2 teeth, 3 teeth, or at my office, we do all of them. So you can do as many or as little as you want to kind of get that full functioning teeth or full functioning smile back, the aesthetic look of it. Things nowadays, the materials that we can use nowadays, they're much more aesthetic than they used to be in the past. The labs are doing a great job. You know, you definitely have more options than you ever had in the past. Don't know why you'd get weird or rude looks asking about implants. We talk about them 3 hours a day to our patients because that's a mainstay now in dentistry. I need my wisdom teeth taken out, and I'm pretty sure I have some cavities. Can they get rid of cavities while I'm under anesthesia for my wisdom teeth removal? I'd like to get it done all in the same appointment because going to the dentist makes me nervous. Sorry, no offense. No offense taken. You are a part of the 100% population that doesn't like coming to see us or coming to see me. And I will tell you, any dentist that you ask that to will love you forever. because you coming in, being put under or put to sleep, and then having the ability to have all of your work done at one appointment is a fantastic thing. As long as you're not doing anything crazy and you're not in the chair for 5, 6, 7, 8 hours like that, absolutely your dentist is going to want to do it. Now, the big thing is not all general dentists do anesthesia to put patients under. Okay, usually oral surgeons do that for wisdom teeth. If you go to an oral surgeon, they are not going to do your cavities or remove your cavities unless they get together with your general dentist. I will tell you, it is becoming more and more popular for general dentists to get what's called an IV sedation license to be able to put patients to sleep, as it's called quite often, and having that stuff taken care of. I love when my patients come in, let's say they want all their cavities taken care of, they want crowns, they want whatever they want to be taken care of or need to be taken care of. When they want to do it in one appointment, whether they want to be put to sleep, like this patient I think is talking about, or if you want to do an oral sedation, which is basically you take a pill and kind of relax and go to sleep, I think it's fantastic. I think it's a great asset for any practice and any practicing dentist, because you can help people not only with their work and getting all their stuff done in a timely, easier fashion, but not only that, you can take care of what's the biggest issue in dentistry, and that's fear. People are terrified to come to the dentist, even if it's a cleaning, if it's a shot, if it's a filling, if it's a crown, if it's getting a tooth pulled out, whatever it is. So adding that little extra oomph that you can give patients and help with putting them to sleep so that it's a they don't remember it kind of thing. Patients love that. I think it's a fantastic thing to do. Yes, if you have a trained dentist that you go to or that is in your area that can put you to sleep with IV sedation, they will definitely take care of your cavities, your wisdom teeth, all that stuff at one time. That is a fantastic question. We get asked that all the time. Great question. Dry socket. So I know you shouldn't smoke after you have tooth extraction. This is my face doing that. Don't smoke after you get a tooth pulled. But does it make a difference if you have stitches or not? If it's stitched up, wouldn't the blood clot on the inside of the stitches, therefore harder to dislodge, or am I making things up to justify smoking? You are making things up to justify smoking. You are going to cause major issues. I don't care how good your surgeon is, how good your dentist is, whoever took the teeth out, how good the stitches look, anything like that. You are skyrocketing your possibility of getting a dry socket, pain, discomfort, added infections, anything like that when you are smoking right after having something or a tooth pulled. A couple reasons. The heat and the open wound and tissues don't go well. The other thing that people don't realize, and one of the main things they tell you, is that sucking motion that you have to do when you smoke it in, right? You don't want to do that. You are literally going to dislodge things. Even if there's stitches over, all that kind of stuff, because you have stitches over it, the blood's not going to just immediately not go anywhere anymore. So do not smoke after you get teeth pulled. You are going to have problems. I am telling you, if you are one of the lucky ones that has the ability to do that and not have problems, you're a rare breed. Your dentist, your surgeon, whoever should tell you to not smoke after you have a tooth pulled. You are going to highly, highly cause major issues. One quick story on this, because I will never forget it. It was one of the funniest things that I've ever seen. I was in residency. It was like my second week in residency. I took out all these lower teeth on this patient of mine. Great guy, super friendly, very nice. But at my residency on the first floor, we were all glass windows, right? So we could see out, they couldn't see in. So we give the same things, which most of your dentists and surgeons should do. You give instructions, what to do, what not to do, how to take meds, when not to take meds, all that kind of stuff. So we give it to him. We go over everything, all that stuff. He's well aware, repeats all this stuff back to me like we've always done. Walks outside, pulls out all the gauze that we just put in there, and I'm not kidding you, less than 3 minutes after, pulls out all the gauze that were sitting there, and he is directly 20 feet to the right of me, outside, and lights up and just starts smoking. I was like mind blown. It was actually hilarious at that time because he's just a funny guy like that. And then later that afternoon, he came back to see me and asked why he was having issues. My assistant, who's a sweetheart at the time, basically just told him that we saw you smoking. We know what you're doing. We know why you're having issues. We're going to have to kind of clean you out, go some stuff like that. But do not smoke. And he kind of made light of the situation. It made it a little bit easier because, you're frustrated, obviously, when patients don't listen to you. That's kind of the norm that we do. Just like patients are frustrated when the dentists don't listen to them. So it's a two-way street. But that was my ultimate smoking and dry socket conversation, because it was a nightmare after that. He didn't heal well. We had to put him on a bunch of meds. It was just a big deal. But do not smoke after you get a teeth pulled or a tooth pulled or anything done, really. It's just not good for you. So try not to smoke at all. That'd be great. But definitely don't do it after you have teeth pulled, because it's just weird. So good questions. Reddit. Doing great. I like it. Like, subscribe, keep sending questions, comments, threads, any of that stuff that you want us to take a peek at. You know we love doing these videos. They're always a good time. So please let us know. Appreciate y'all. See you soon.